Preceptorship has always been a really important aspect of my learning. Even from when I was a student, I was quite interested in the preceptorship experience and how connections are made. Moving from the scholarly learning to the actual hands-on application was something that always interested me.
It's the greatest thing in the world to see how preceptors that usually have been nursing for a fair amount of time just really do blossom in these roles. The nurses that act as preceptors and the ones that do it more frequently, usually, you see them, a bit of a spark come alive in them, and it's just the most amazing thing to see.
I really made sure that when I became a registered nurse that preceptorship became a focus of my learning, because I saw the opportunity to continue to learn myself through pointing out all the new information that's coming from new nurses that are coming in.
Sometimes we forget that, best practice changes over time, and we can also learn from the preceptee, what they're learning in school and how things are going in the newest best practice way, because things change quite quickly over time. And even from when I was in school 5 years ago, it can be different now.
I feel that the students teach me just as many things as I teach them. I also learn from their experiences, and I enjoy sharing my own with them.
Being a preceptor gives us an opportunity to co-learn with our students. For example, I had a student with a really strong surgical background. I was preceptoring him in ICU, and we had a vac dressing to do, and it had been a really long time since I had done one, and he was very adept at it. So we went into the room and we did the vac dressing together. He gave me a few tips and tricks for how to do that properly. We were able to work through some of the challenges that we came across with a more complex dressing than he had done on the surgical floor before. But together we were able to work through it and problem solve.
It's not very common for the ICU to get post-ops, and I think in one set we had 4 post-ops, like just back to back to back. Every shift we were receiving someone from the OR, and there was a lot of things that they weren't used to doing or knowing where to look, and that was second nature for myself, so I was able to show them things and they were able to show me things. It's just kind of a mutually beneficial learning scenario. So just because you're a preceptor doesn't mean that you can't learn from the preceptee.
You'll see preceptors now are looking up things with students in disease processes that maybe they wouldn't have before, because it's something that they've known maybe for a long time, but looking into new literature that maybe would bring about some new topics and new points of interest, latest research. And so the preceptors are learning too. So they're getting to grow their professional practice and also assisting and growing the students' professional practice. So it's quite a collaboration, and it's really amazing to see.
I had this weird misconception when I first started preceptorship that I had to know all the answers. And the reality of nursing is, more often than not, we don't fully know the answer, and we need to look to our policies, procedures, we need to look it up in a text, we need to talk to a doctor, we need advice from our charge nurse. And that's the aspect that I kind of missed in my first preceptorship experience, because I felt so much weight and pressure to provide these perfect responding answers. And then instead, when I moved forward and started embracing the aspect of like, you know what, I don't actually know, let's go to where we can find that out. Alongside that is sharing experiences when you've been fallible, when things haven't worked out properly.
Working with preceptors can help us learn from our mistakes.
I remember sharing with my student, there was one time I had pulled a medication out of Omnicell, and when I started to pour the medication, I reread the label and realized it's totally the wrong drug. Thankfully, it was caught before we reached the patient, but then we went through all the steps of how we contacted pharmacy, contacted the PCC, contacted management, and was able to change that medication, change the labeling, move it to a different location.
During my first surgical rotation, I had 4 patients in a room, and the kitchen came by and delivered all the trays out, and I went around and made sure it was the right names, so everybody had the correct tray. But one of the patients was ordered a tray by accident, and shouldn't have been ordered one, and we had just started clamping his NG to see if he could tolerate that before we removed it. And of course, with this nice meal in front of him, he hadn't eaten for a week, he scarfed it down. And of course, that ended up all over the bed. Once we cleaned him up and made sure that he was okay, the preceptor asked me, "So what did you learn here, Sybil?" And I said, "Okay, well, I checked everybody to make sure that they had the right name and the right tray, but I should have put the situation together, given that the patient was getting his NG clamped and we were going to put it out, and I didn't." And she said, "Yeah," she's like, "one of the things that we learn eventually as a nurse as we're starting to get going is that we own our room, that we are responsible for what happens in our room. So just because somebody was ordered a tray doesn't mean that they should get it, and we need to take our situational awareness into consideration when we're trying to see what appropriate treatments or food the patients are getting."
One of my students had a medication error, and I used the opportunity to tell her about my first medication error, just to kind of show that we're all human and we make mistakes, and just ways that we can prevent the errors from happening in the future.
These things happen a lot, and students are already at a high stress and trying to prove themselves when they're in these clinical scenarios, and we need to be able to alleviate that stress by showing them that, you know what, we still make mistakes at this point, and then just showing the way that we can recover from that and move forward with that, and that we take that experience and instead of hiding it, we take that experience and share it with others so that we can all move forward from that idea.
I've always found being a preceptor really rewarding. Of course, it's a little extra work, especially when your patient is very busy, but to see those light bulbs go off in the student's head and see them pulling things together and seeing them, really happy to come to work and work with you in the morning, it's really satisfying.
In my history of being a preceptor, I have always found it so fulfilling, and the ability to share the knowledge that you have and help to build that knowledge for your own practice and for the students is really invaluable. I know that when I was a preceptor years ago on the unit that I worked in, the last intensive care unit, then one of the nurses that I preceptored still works there today, and she still tells stories about the preceptorship that her and I shared together, or that when I precepted her, and remember that time that this happened, and those memories really stuck for her, and they were really good learning points. And I remember that preceptorship with such fondness too, because it's a relationship that we've kept both professionally and turned into friends as well. And it turned into a mentorship, really. It was what it ended up to be, which was really, really invaluable for both of us. So preceptorship for me has always been they're great points that stand out for me, and really proud to be a part in the fellow nurses that I work with in their growth and in their professional development, and then in mine.
One of the key focuses of preceptorship is understanding that these students are going to be our coworkers. Each student that you come in contact is hopefully going to stay as a nurse. That's our goal, is to try to fill in these voids that we have and support them through that experience. So when you're taking on a preceptorship student, part of it is also envisioning that you're also taking on a coworker. And that not just a coworker, but you're also taking on someone who might take care of you or someone in your family. The more that we envision our students being our coworkers, we let down the barrier of like this hierarchy of power. We now become coworkers working together, and one just has more experience than the other.
There are a number of preceptor resources available to help you build your preceptor practice. The practiceeducation.ca modules are a series of 8 modules that cover most basic topics of preceptorship. They help you learn how to provide effective feedback, how to foster clinical reasoning and clinical decision making. So I really recommend those, and when you're finished you can do the iLearn 2432. There are also a number of resources on the Learning Hub. You do have to register to use them, but you can go in and work through the modules at your leisure. There's also a voiceover PowerPoint that we have done to help highlight some of the key points using the SCARF model to help us build learning cultures within our units.
For the college, it's absolutely essential that we have people who are willing to play that role. And in my experience, they put far more into it than is written down. It's a bit of a capstone to take somebody under their wing and show them the ropes, and it's a giving back. And I think for a lot of people, it's coming back full circle, because they had somebody at the start of their career who showed them the ropes, and now they can pass that on. We really do appreciate the effort that's put in. I think, in fact, I would say we couldn't run programs like this effectively. I think that the willingness of people to do that, it really does show dedication to their profession. So my personal thank you to all those who participate.